Welcome to this video, which is the fourth of the series providing analysis of COVID-19 spread. In this video, we will briefly look at the Western Pacific region and then an in-depth analysis of Australia and its states. The Western Pacific region comprises multiple countries spread over a vast geographical area. This view excludes China, but includes all countries in the region with over 500 confirmed cases of COVID-19. South Korea has 9,786 cases, Australia 4,359 cases, Malaysia 2,626 cases, Japan 1,953 cases, the Philippines 1,546 cases, Singapore 879 cases, and New Zealand 600 cases. From we can see from the graph, all the countries appear to be flattening the curve. This section shall deal with COVID-19 in Australia and its states and territories. The data in this view looks at new cases in Australia and cumulative cases over time. There are over 4,000 cases, but we are seeing perhaps the first embryonic signs that Australia is managing to flatten the curve. This view looks at total confirmed COVID-19 cases by sex and age group. The median age of a person with COVID-19 in Australia is 48. There's roughly an even distribution between males and females. Cases are largely centred on age groups 20 to 79. This view looks at the transmission and total cases of COVID-19 by states and territories. The majority of Australian confirmed cases acquired their infections overseas, including cruise ships, or associated with recent travel to Europe or America. There are signs of community transfer in New South Wales, Victoria, Queensland, some in WA and South Australia. This view looks at COVID-19 cases in Australia's states and territories over time. As previously stated, there appears to be the embryonic signs that the curve is being flattened in Australia, including New South Wales. Since last week, New South Wales has seen an increase in 1,214 cases, Victoria 503, Queensland 346, WA 189, South Australia 167, ACT 41, Tasmania 33, and the Northern Territories 14. Looks at each individual Australian state and territory. The largest increase occurred in New South Wales, and there have been a number of gaffes by the local government in New South Wales, i.e. management of cruise ships. But they are getting increasingly forceful in the management of the people, especially around physical distancing. Testing is a high priority in all states. Similar to last week, New South Wales continues to record the highest numbers. Victoria and Queensland have similar numbers and about 4 days behind New South Wales. South Australia and Western Australia are tracking together and about 7 days behind New South Wales. ACT and Tasmania are tracking together and they're 2 weeks behind New South Wales. Northern Territory is the place to be. The next views look at restrictions imposed in Australian states and territories and punitive penalties. In Australia, the federal governments are responsible for the external borders, i.e. who flies in and who flies out, and a multitude of other. The state government is responsible for the day-to-day management of its population and healthcare and policing. Generally, there is consistency with quarantine restrictions and travel restrictions, but there are little consistency around how penalties are applied and who applies them. These next several views look at the critical aim of governments to flatten the curve and what you must do to assist during this crisis. This view compares the number of hospital beds per 1,000 inhabitants in major economies. In red is Australia. Australia is the middle of the road, not the best and not the worst. Australia has 3.8 beds per 1,000 inhabitants. The best, Japan and South Korea, have almost 3 times as much. This view looks at the profile of critical care beds across Australia. Australia has 8.92 critical care beds per 100,000 inhabitants. This equates to 2,229 beds. More than a third are in New South Wales. In a severely impacted COVID patient who requires intensive care, data suggests they will block an ICU bed for approximately 20 days. The normal average for an ICU patient is 4 days. These beds are not sitting empty. The majority are already utilised with patients with life-threatening condition. The government stopped all elective surgery, thereby freeing up extra capacity, but these are not critical care facilities. The staff will need training and equipment installed. This is why you must play your part by physical distancing, washing your hands frequently, monitoring and isolate. Communications are key in getting the population to understand and comply with restrictions. The federal government and state governments are holding daily press briefings which are broadcast live on national TV and web services. Additionally, they have launched apps for smartphones and introduced telemedicine. It is normal to feel sad, stressed, confused, scared or angry during a crisis. Talking to people you trust can help. Contact your friends and family. If you must stay at home, maintain a healthy lifestyle, including a proper diet, sleep, exercise, and social contacts with loved ones at home and by email and phone with other family and friends. Don't use smoking, alcohol, or other drugs to deal with your emotions. If you feel overwhelmed, talk to a health worker or a counsellor. Have a plan. Where to go and how to seek help for physical and mental health needs if required. Get the facts, gather information that will help you accurately determine your risks so that you can take reasonable precautions, find a credible source that you can trust, such as the World Health Organization website or a local or state public health agency. Limit worry and agitation by lessening the time you and your family spend watching or listening to media coverage that you perceive as upsetting. Draw on skills that you have used in the past that have helped you to manage previous life's adversities and use those skills to help you manage your emotions during the challenging times of this outbreak. There is a mountain of information available on COVID-19 and some are not that accurate. It is important that you are looking for information. You look in a location that has reliable, accurate information. Some good ones are listed here. Finally, remember to socially check in with your family and friends and use any of the smart apps on your phone. Don't assume everything is fine because you haven't heard from them. Do welfare checks on work colleagues. That's good leadership. The elderly are not as skilled with modern technology than you. Conference calling can be set up, but be patient and innovative in your problem solving. Do not book a cruise on a floating incubator. Feel free to drop me a note via email, YouTube, LinkedIn or Facebook, etc. Thank you.